Question number 1. What condition results from the destruction of myelin sheath and the central nervous system? The correct answer is option A, multiple sclerosis. Question number 2. Which vitamin deficiency is most likely to cause neural tube defects in newborns? The correct answer is option C, folic acid. Question number 3. What is the most appropriate nursing action when a patient develops a transfusion reaction? The correct answer is option B, stop the transfusion immediately. Question number 4. Which route of drug administration ensures the fastest absorption into the bloodstream? The correct answer is option B, intravenous. Question number 5. What is the best indicator of adequate tissue perfusion in a patient with shock? The correct answer is option C, urine output. Question number 6. Which nursing intervention prevents a deep vein thrombosis in post-operative patients? The correct answer is option A, encouraging early ambulation. Question number 7. What complication can occur from a rapid correction of hyponatremia? The correct answer is option B, osmotic demyelination syndrome. Question number 8. Which diagnostic test confirms myocardial infarction most specifically? The correct answer is option D, serum troponin level. Question number 9. What positions should a nurse place a patient in after spinal anesthesia? The correct answer is option C, supine with heat plate. Question number 10. Which nursing assessment findings suggest hypocalcemia? The correct answer is option D, positive Trosia sign. Question number 15. What is the priority nursing action for a patient experiencing anaphylaxis? The correct answer is option C, maintain airway and administer epinephrine. Question number 16. Which electrolyte imbalance is associated with platinum T waves on ECG? The correct answer is option B, hypokalemia. Question number 17. What nursing assessment finding indicates a right-sided heart failure? The correct answer is option C, peripheral edema. Question number 18. Which infection is transmitted through ingestion of undercooked pork? The correct answer is option C, trichinosis. Question number 19. What nursing action helps prevent aspiration in an unconscious patient? The correct answer is option B, positioning the patient in lateral side line. Question number 20. Which finding indicates effective suctioning of a tracheostomy tube? The correct answer is option B, clear breath sounds and improved oxygen saturation. Question number 21. Which laboratory test is most specific for diagnosing acute pancreatitis? The correct answer is option B, serum lipase. Question number 22. What nursing action is essential when administering potassium chloride IV? The correct answer is option B, dilute and infuse slowly using an infusion pump. Question number 23. Which clinical sign indicates early hypoxia in a patient? The correct answer is option B, restlessness. Question number 24. What nursing assessment findings suggest fluid overload during IV therapy? The correct answer is option C, crackles in lungs. Question number 25. Which organ is primarily responsible for erythropoietin production? The correct answer is option B, kidneys. Question number 26. What is the nurse's best action when a patient with diabetes becomes confused and diaphoretic? The correct answer is option B, check blood glucose and give a fast-acting carbohydrates. Question number 27. Which nursing action prevents food drop in a bedridden patient? The correct answer is option A, using food boards or high top shoes. Question number 28. What precaution should a nurse take when handling a cytotoxic chemotherapy drug? The correct answer is option A, use double gloves and protective gown. Question number 29. Which sign indicates digoxin toxicity in an elderly patient? The correct answer is option B, bradycardia and visual disturbances. Question number 30. What is the nurse's first action when a patient suddenly develops shortness of breath post-surgery? The correct answer is option A, assess airway and oxygen saturation. Question number 31. Which diet is most suitable for a patient with chronic kidney disease? The correct answer is option B, low protein, low potassium. Question number 32. What is the best site for intramuscular injection in infants under 1 year? The correct answer is option A, vastus lateralis. Question number 33. Which phase of wound healing involves collagen formation and scar tissue development? The correct answer is option B, proliferative phase. The question number 34. What nursing intervention helps reduce intracranial pressure in a head injury patient? The correct answer is option A, keep a head midline and elevate 30 degrees. Question number 35. Which condition results from the absence of insulin production? The correct answer is option A, type 1 diabetes mellitus. Question number 36. What nursing assessment finding as characteristics of hypovolemic shock? The correct answer is option C, cool, clammy skin. Question number 37. Which hormone regulates calcium and phosphate balance in the body? The correct answer is option A, parathyroid hormone. Question number 38. What is the priority nursing action during a fire in a hospital ward? The correct answer is option B, rescue patients in immediate danger. Question number 39. Which vital sign change is expected after administration of morphine? The correct answer is option B, decreased respiratory rate. Question number 40. What electrolyte imbalance is common in patient receiving loop diuretic like furosemide? The correct answer is option B, hypokalemia. Question number 41. Which condition is most commonly associated with moon phase and central obesity? The correct answer is option B, Cushing's syndrome. Question number 42. What nursing measure reduce the risk of pneumonia in immobile patients? The correct answer is option A, encouraging deep breathing and cupping exercise. Question number 43. Which electrolyte imbalance is most likely after severe vomiting? The correct answer is option B, hypokalemia. Question number 44. What is the best nursing position for a patient with dyspnea? The correct answer is option B, high Fowler's position. Question number 45. Which lab test result indicates poor diabetes control? The correct answer is option B, HbA1c greater than 7%. Question number 46. What nursing assessment findings suggest left-sided heart failure? The correct answer is option C, crackles in lungs. Question number 47. Which dietary advice is appropriate for a patient taking warfarin? The correct answer is option B, maintain consistent intake of vitamin K foods. Question number 48. What is the most appropriate nursing intervention for a patient with neutropenia? The correct answer is option B, avoid crowds and sick people. Question number 49. Which part of the brain regulates body temperature? The correct answer is option C, hypothalamus. Question number 50. What is the purpose of incentive spirometry after surgery? The correct answer is option A, prevent atelectasis and improve lung expansion. Question number 51. Which condition is characterized by sudden chest pain and shortness of breath due to air in the pleural cavity? The correct answer is option A, pneumothorax. Question number 52. What is the best way to assess pain in a non-verbal adult patient? The correct answer is option B, observe facial expression and body movements. Question number 53. Which nursing diagnosis is most appropriate for a patient with diarrhea? The correct answer is option B, deficient fluid volume. Question number 54. What nursing action should be taken when a patient receiving IV fluid develops swelling and pain at the side? The correct answer is option A, stop infusion and remove IV line. Question number 55. Which vitamin is essential for normal blood clotting? The correct answer is option B, vitamin K. Question number 56. What is the main purpose of pulse oximetry? The correct answer is option B, to measure oxygen saturation. Question number 57. Which infection control technique prevent transmission of infections through hands? The correct answer is option B, frequent and proper hand washing. Question number 58. What is the first action of a nurse when a patient complains of chest pain while on ECG monitoring? The correct answer is option B, assess vital sign and oxygen saturation.